AVR, today's best country.
Joining me in studio today is John Campbell. He's the head of Annapolis Valley Health, Mental Health and Addiction Services, and we're going to continue trying to lift the veil of stigmatism around mental health. Let's talk about how it affects the family. How do you witness somebody in your family that's close to you go through a mental illness?
It's certainly difficult, and it does impact the family members and impact everyone around the individual. And that's why mental illness is everybody's concern. We have mental health services, and we provide services to individuals that have a mental illness. But it's the community's concern too, because we want to support individuals in our communities, whether it's children or adult, the unemployed, the individuals that may be impoverished. We need to be concerned about their welfare. So when we talk about mental health, we talk about it as being everybody's concerns. One of the issues that we often see within families that are dealing with an individual that has a mental illness is that the demands on that family are significant. And we often talk about burnout, that they attempt to deal with it as best they can, but don't have the skills or the knowledge to do that, and drain themselves in the process. And these are individuals that we encourage to get help for their own emotional needs, but oftentimes for the kinds of skills and education to understand the illness and how to manage it within their family member. We do that within mental health services, but we also have other agencies in our community to do that. The Schizophrenia Society is there for family members to help them, to guide them, and to educate them on how best to manage individuals within their own family that are experiencing that, and also how to navigate the system, to know what's available. The same with the Canadian Mental Health Association, another advocacy group that is there to assist individuals that have a mental illness as well as their family. And even within our services, one is we're dealing with people that are suffering the emotional impact of a family member with a serious illness, or the support that we can give them, and again, giving them the skills that they can better manage and assist an individual with a mental illness. Family members are extremely important as part of the recovery process. First of all, they have a relationship with the individual with mental illness, and they're there with them. And if we can arm them with the skills and expertise to assist in that process in conjunction with our own professional services, we're more likely to have the best outcomes for that individual.
Now, these are great. You have lots of things that families can do. What happens if the person in the family with the mental illness refuses to get treatment? You really can't force them into it.
That's right, and that's a very good point. Our services are voluntary services. People have the right to choose the kinds of services they want, their kind of health needs that they want. And this is a barrier sometimes, because mental illness sometimes impacts the insight that the individual has that it's their problem. And what we try to do is, one, have the individual that is affected by that, meaning the family, talk to their family physician. The family physician is there as a resource and is the first point of contact to access the range of services that are available in a healthcare system. So we always encourage individuals that are having those kinds of difficulty to talk to their family physician. Secondly, to seek out information. And again, we often refer to the Schizophrenia Society or the Canadian Mental Health Association of Kings and Annapolis counties, because they have a wealth of experience in dealing with this, and they have the knowledge to be able to help people. The third issue is that if people feel that they need information, they can go to our website, they can look at what public educational sessions we will be providing, both now and in the future, or they can call us at our number in the directory and ask for information about what is available to assist families in being able to cope with what they're having to deal with.
But this is a family issue, that it's not easy to see somebody in your family go through this, but it's so important at this time to be able to stick by them.
Very much, because if they don't have that family member, who do they have? Oftentimes, the family member is that link to the kind of social support system that everyone needs, whether you have a mental illness or not. We are social animals. We need what we call those determinants of health. Those are social support systems, the ability to cope within our society, to have sufficient education, to be employed, to have good housing, to have good nutrition. All of those factors, including family support, are necessary for the best outcomes in relation to dealing with mental illness.
Well, John, I really appreciate you stopping into the studio over 2 days to make this happen and just lifting the veil and the stigma of mental health for the Annapolis Valley. I really appreciate that.
Oh, you're quite welcome, Jerry.
That is John Campbell. He's the head of Annapolis Valley Health, Mental Health and Addiction Services. Feel free to call them. Lots of programs for your family.
AVR, today's best country.